Dilation and curettage. What is dilation and curettage? Dilation and curettage is a procedure to remove tissue from the inside of the uterus. It is also called a D&C. Dilation refers to dilation, opening, of the cervix, the lower part of the uterus that opens into the vagina. Curettage refers to the scraping or removal of tissue lining the uterine cavity, endometrium, with a surgical instrument called a curette. Why might your doctor do a D&C? Your doctor might do a D&C to figure out the cause of a symptom or problem. During a D&C, a doctor gets a sample of tissue from your uterus. The sample can then be checked for abnormal cells, cancer, or other problems. What are the side effects of a D&C? The most common side effects are mild cramping and slight bleeding from the vagina, called spotting. These can last for a few days. If you have pain, you can take a pain reliever. Other side effects are not as common but can occur after a D&C. These include a tear in the uterus, injury to the cervix, infection, and areas of scar tissue that form in the uterus. After the procedure, the recovery process will vary depending on the type of procedure performed and type of anesthesia that was administered. Effects of anesthesia. You may feel somewhat dizzy or sleepy after surgery due to the side effects of the anesthesia. General or intravenous anesthesia agents can remain in your body for up to 24 hours. It is advised not to operate heavy machinery, drive a motor vehicle, consume alcohol, or make any important business decisions for the next 24 hours. Try to rest for the remainder of the day. If you received regional or general anesthesia, you will be taken to the recovery room for observation. You will be observed for the following: blood pressure, pulse, breathing, consciousness, being awake and alert. What to do after procedure. After a D&C using local anesthesia, you may rest for about 2 hours before going home. You may want to wear a sanitary pad for bleeding. It is normal to have some spotting or light vaginal bleeding for a few days after the procedure. You may experience cramping for the first few days after a D&C. You may be instructed not to douche, use tampons, or have intercourse for 2 to 3 days after a D&C, or for a period of time recommended by your doctor. You may also have other restrictions on your activity, including no strenuous activity or heavy lifting. Because a D&C removes the lining of the uterus, the lining must build back up. Your next menstrual period may begin earlier or later than usual. You are allowed to take a bath but not swim or soak in a bathtub for at least 2 to 4 weeks to prevent unwanted infection. You may resume your normal diet unless your doctor advises you differently. Take a pain reliever for cramping or soreness. Your doctor may recommend non-steroidal anti-inflammatory drugs, NSAIDs, such as Motrin or ibuprofen to manage your pain. Aspirin or certain other pain medications may increase the chance of bleeding. Be sure to take only recommended medications. Return back for checkup after 1 to 2 weeks. Should I call my doctor? Call your doctor or nurse if you have any of the following problems after your D&C. Fever higher than 100.4 degrees Fahrenheit, 38 degrees Celsius. Cramps that last more than 2 days. Pain that is prolonged or gets worse. Heavy vaginal bleeding, or vaginal bleeding that lasts more than 2 weeks. Or vaginal discharge that is green or smells bad. Remember that if any complication arises, always return back to your doctor for checkup.